everyone. Thank you for being here. We are Conmix, and we're here to change the microfluidics industry, starting with microfluidic mixers. Before we begin, you may be wondering, what is a microfluidic device, or why are they even important? Well, microfluidic devices are very important when it comes to drug treatment, especially when mixing 2 or more drug treatments together. If I were a physician administering drug treatment for a patient, I know that I would want to have a few of these little devices on hand. However, that is where the problem we are solving starts. So, currently, these devices have a lengthy fabrication process, and they are relatively costly considering their size. Because of how long it takes for these devices to be made, many facilities are left waiting for their deliveries to come in while having 0 microfluidic devices in stock. Obviously, this is a problem if you are a physician that needs to treat a patient, or if you are a patient that needs to be treated. This is where Conmix comes into play. So, Conmix is utilizing 3D printing technology, and we're using a new base formula for our base material in our mixers to save our customers time and money while providing them with a better product. Our products have been proven to provide better mixing capabilities, to produce better concentration gradients, and deliver precise drug concentrations at slow and steady rates. Hi, my name is Melissa Dizdarovich, and I am the founder of Conmix. I am in my 4th and final year of chemical engineering here at the University of Utah. I have had several research positions, and I've also worked hands-on in the development of Conmix's devices.
Hi, my name is Ellis Khan. I'm a senior here at the University of Utah, studying mechanical engineering, and I'm Conmix's business developer.
My name is Andrew Peterson. I'm a senior in electrical engineering here at the U. I have 2 years of experience in the medical device field, and I will be the financial manager for Conmix. And as a team, we really pride ourselves on our efficiency, innovation, and our dependability. Going forward, as we continue to hire and grow our company, these are 3 of the main aspects that we'll be looking for. So when people think of Conmix, that's what we want them to think of. Now, going into the market, in the medical industry today, microfluidic devices are huge. Over 95 million of these devices are sold each year, and honestly that number would be much larger if the manufacturers could keep up with demand. As it is, a lot of manufacturers are often out of stock, and the current wait time is nearly a month simply to fulfill orders at the moment. So lead times like that, there's obviously a lot of room for new companies to step in and to have a business grow and flourish. The current global market size, is huge. In 2021, it was valued at $23.6 billion, and experts predict it to be worth up to $60 billion by 2028 in just 6 years. However, before jumping into the global market, we plan to get a solid footing right here in the US. Now, the US makes up about 45% of the global market, valuing it at about $10.6 billion. And it is our plan to build up our company until we can service 10% of the US, giving us a $1.06 billion market that we can reach and service. And I will let Melissa tell you about the products that will get us there.
So what exactly is our product? This is it. This is a microfluidic mixer. Our product can be made so quickly because we are using specialized 3D printers along with a new base formula to make more efficient mixers. Our entire product is not 3D printed because this would obviously make other manufacturers of these devices to do the exact same thing. Instead, with these printers, we have developed a new formula to put into these molds that are being created to create our devices. So along with this new formula and our quick production rate, this is what makes Conmix really stand out. And because we are able to print out the most important part in developing our products, this means that we can implement new channel designs for testing, and then once we can clear these designs to be used as products, we will be able to make them very quickly. And so now we are moving on to our business model. So our business model says that we are able to capture 12% of our available market. However, as you can see by our calculated revenue in 5 years, we are below this. The reason for this is infrastructure. So currently, if we were to keep our business as is, with the same number of personnel and the same number of 3D printers being used, we can only print up to 175,000 Conmix mixers each year. This leaves us short of meeting the demand that we are able to capture just because we are lacking in the facility and in how many printers we have, how many people we have employed. And so we are selling our mixers at $100 for each device, and this is relatively cheap compared to our competition, which Ellis will discuss soon. And we are making them for less than $20 a piece, giving us a clean $80 for each singular device. And if we were to have the right infrastructure and the costs to fund that, we would be able to capture that entire 12%.
So we have 3 main adoption strategies. First is medical conferences. You want to go to medical conferences with our device and showcase it to the people who will be using it day in and day out, doctors and physicians. Getting doctors on board with our product will be key to our company's success going forward. Secondly is partnerships with hospitals, not only in Utah, but also in the Western US. We want to start first with the University of Utah, here where we all go to school and right where our company is founded. Then we want to expand across Utah and finally across the Western US to larger institutions such as UCLA and UCSF. Finally, we want to go to medical device trade shows. We'll target drug administration trade shows as this is the particular industry that we're in, and we hope to gain traction in that same industry by going to these trade shows with our product. So next, our competition. We have 3 main competitors in the market. The first is Ufluidics. Ufluidics is a major manufacturer of these devices. They are simply a manufacturer though, and they do not design any of their own devices. Other people go to them with their devices just for their manufacturing capability. Secondly is Dolomite. Dolomite makes a similar product to ours, but it can mix 3 drug treatments together instead of ours, which mixes 2. This comes at a much higher price tag of $480 versus ours that retails at $100. Finally, there's Persegeno. Persegeno has a very similar product to ours, where they also mix 2 drug treatments together, and theirs is made out of glass. Theirs retails at $289, whereas ours retails at $100. Ours also provides superior mixing capabilities when compared to theirs. So some competitive advantages that we have across the market are first and foremost, we are the cheaper alternative. Due to our design and using 3D printing technology, we can manufacture our product for only $20 per device. That means we can retail ours for $100, which is very similar to what our competitors can manufacture with that. Secondly is time. With our 3D printing technology, we can save manufacturing time by over 50%. This means that we can provide hospitals more of these products at a quicker rate. Finally, our performance of our device simply mixes these drugs together better than others on the market.
Indeed it does. Thank you, Ellis. So, to go over our finances really quick. To get our company up and started, we only need $200,000. This will give us the printers that we need, facilities, the starting materials, as well as other just miscellaneous expenses that come with running a business, of course. Manufacturing costs, what we've calculated, will come to just over $2 million. However, this is accrued throughout the year, and as we begin selling our product, this is something that we'll be able to make back and pay for as we go along. And our revenue after just the first 12 months is calculated to make it to $10.6 million. This is something that we find very achievable in this market, and we are confident that this is what we can do. So not only do we see microfluidics as a fantastic business opportunity, we believe that ComMix really is the way to get life-changing technology to people who need it at a cheaper and faster rate. So we invite you to invest in the future of drug treatment today with $100,000 for 10% of ComMix. Thank you all very much for your time. We'd be happy to answer any questions that you have. Feel free to ask away. All right, we answered them all. Yes. That's okay. Yeah. Yes, go right ahead.
You mentioned that you have better performance in your mixing. Has that been, what did you compare that to?
So we compare that to with the drug concentration that is produced at the end and how consistent ingredients are. If there are some, like there's splotchiness in certain, when you take that, it's out of like a little tube that comes out of it. If it's like splotchy and not very well mixed, you're able to compare it with a percentage. And we put ours in it, and it was better. And every time they at least met the competition or was better. And so there's not a distinct, this is how much better we are, but in every case it was either just as good or better, and in most cases it was better.
So you guys are going to be printing this product on a 3D printer, and then after the product comes off the printer, you're going to have to do some type of QA to make sure that the flows are at the right speed and that the mixing is, is accurate, right? That you're actually producing an accurate product. So like, what's the plan for QA after the product comes off the printers?
We're printing out the molds, so we're printing the device itself isn't printed, and there's a recipe of formula that we've created, which is kind of, it curates really quickly. We put it into a kind of a UV chamber, and we put that in, and we seal it off. So after that's sealed off, usually the specs between different devices are very consistent, and so we don't have to do much testing on them after we develop one design. So they've already been made, and they're just, that's the process. You print that out, you put the mold in, it's like you pour it into this formula, and then you curate it, and then you have your device ready.
Okay, thanks.
Yes.
What is stopping other businesses to replicate what you guys have done?
It's the formula that's made that's putting it together.
So it really is cutting edge technology that a lot of research has gone into. And this is stuff that we've learned and we've got the recipe.
Yeah, and every mold for every design is different. We create them online digitally, and then we print them out, and then you put that formula in. And you can adjust some of the formula depending on what each thing's being used for. We have one standard one that works really well.
Did you develop that one, or were you purchasing formula?
We created it, so the main base this is kind of getting into technical questions, but the main base is called PDMS. It stands for some really long chemical. And we have a certain percentage of that into it, which most microfluidics do. Microfluidic devices do contain PDMS in them. So we're mixing that with several other things. I'm not going to say the exact things because then that give away kind of our advantage. But we're mixing that, and that kind of that formula what we have is able to make it curate faster, and kind of it makes it so that the drug doesn't stick to the walls either. Because that's also a problem in other devices where the wall gets to have like build up, and you're not getting the full concentration going all the way through.
Thank you.
Yeah.
Any other questions?
If not, thank you again for your time. We appreciate it. Have a great evening.